This is Abia COVID-19 Update. Abia COVID-19 Update.
Well, as we learn more about COVID-19, it's increasingly clear that your risk of severe illness and death increases with age. There are both physical and social reasons. Older people don't have as strong as an immune system, so they are more vulnerable to infectious disease. They are also more likely to have conditions such as heart disease, lung disease, diabetes, or kidney disease, which weaken their body's ability to fight infectious disease. The elderly might also have isolation or mobility challenges. So because they are isolated, they can't get information about what to do, or they are not able to get food they need to eat, stores out of stock, and things become more difficult. In many societies, seniors, the elderly, are more likely to live in poverty, which makes it more difficult for them to get the things they need and to take care of themselves. Poverty represents a whole range of challenges pertaining to health. There are more reasons that older people are more vulnerable and susceptible to COVID-19. You will hear that later today by our resource person. In fact, Dr. Chikwe Hiekwazu, the NCDC boss, emphasized yesterday the reason to collectively protect our elderly. Welcome to the program. It is the third edition for the month of July. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as the Abia State Governor, Dr. Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. This program is running simultaneously every weekday, Mondays through Fridays, on several radio stations in the state: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Now, let me quickly give you the update, the figures, and of course the developments across the world and also in Nigeria before we go straight to the discussion today. Global cases are nearing 11 million. There are 11,001,023 known infections worldwide. That's as at 8 a.m. when I got the data this morning. 524,406 deaths have been recorded. Also 6,162,463 persons have recovered globally. South Africa, with about 58 million people and nearly 40% of all the cases on the entire continent, Africa continent, has seen the number of confirmed infections rise from 34,000 as at the start of June last month to more than 168,000 yesterday. Although some of that is thought to be due to efforts to clear a testing backlog, and the rate of increase of new cases is picking up. The past week has seen the United States break its own one-day case record 4 times, according to data also, and in 7 days up to and including the 1st of July, the country which has the highest number of cases and deaths worldwide confirmed more than 40,000 cases in 4 separate days. Nigeria Center for Disease Control yesterday announced 626 new cases of COVID-19, bringing the total number of confirmed cases in the country to 27,110. 13 deaths were recorded from the virus, bringing the total number of confirmed deaths from the virus to 616. Giving a breakdown of the cases, the agency said there were those cases, the 626 cases were recorded in 20 states, and of course Abia State also part of the 20 states. 31 new cases were recorded in Abia State. So it's very important we keep staying safe. Social distancing measures, we keep talking about this right here on the program. And of course, joining me this morning all the way from Dubai, that's the United Arab Emirates, is Dr. Ngozi Erondu, infectious diseases epidemiologist and a global health policy expert, a senior research fellow at the Chatham House Center for Global Health Security, and also a senior public health advisor at Public Health England. Doctor, good morning to you.
Good morning, Michael. Thank you for having me on the program today.
All right. Good to have you join us this morning. Now, we're talking about coronavirus. You're very much aware with the virus right now as an epidemiologist. Now, we've been talking about curve in Nigeria, flatten the curve. What exactly do Can we say is the meaning of flattening the curve?
Yeah, that's a very good question, Michael. I think if your listeners have ever gone onto the Nigeria CDC website, they would have seen kind of like a depiction of when different, like for every day, what is the onset of illness. So that's what we call an epidemic curve. We look at every day and how many cases we have every day. And as that kind of line goes up, it eventually will start to peak. So that would be, if you think of a curve, it would be the top of a curve. And then it starts to go down. And so when we say flattening the curve, we think about, that peak represents the highest number of cases that you can get at one time. And when you have a lot of cases in one period, what you have is an overwhelm of the health system. So just think about it. The people who, we all know that for COVID-19, there are a lot of mild cases, but there are also a lot of serious cases. There are people who need to go into the isolation center. There are people who need to go to the doctor and be observed. And when you have so many people within the healthcare system at one time, it overwhelms the healthcare system. And that actually can create even more infections, because people who are going to see their doctor, going to the clinic, going to get, just regular medicines for malaria, for headaches, for anything else, now they are exposed to many more people who are infected with COVID. So flattening the curve means instead of having that huge peak, let's make the amount of people, let's do our society in a way, let's have our public health response be in a way that the amount of people that get infected at one time is spread out over time. And so instead of that very sharp peak, you have a flattened curve, meaning that
Dr. Ngozi,
the infection spreads slower.
Dr. Ngozi, permit me to cut in here. Now, let's talk about the mortality rate in Nigeria. Just yesterday, it was said right here in Nigeria during the daily presidential task force on COVID-19 briefing that 3 out of 5 infected confirmed cases in Nigeria are those between the ages of 50 upward. Now, it looks like those at that age bracket now, 50 upward, are at more risk. They are very much at more risk than those below that age bracket. Can you enlighten us? Why that?
Yeah, sure, Michael. Actually, before I answer that, I'm going to finish flatten the curve because I think it's important.
Oh, okay.
The point is that I think it's very important that if we have less people getting infected at once, then we're not going to overwhelm the healthcare system. And people can slow down the rates of infection if they stay at home, if they social distance as much as they can, if they wear masks and do different protective measures. So that is what flattening the curve means. I think it's very important. I think at the beginning of the program, you explained quite well why people that are over 50 may be more susceptible to a virus such as SARS-CoV-2 or the virus that causes coronavirus. Because of weakened immune systems, because a lot of people over 50 may have existing diseases such as diabetes or hypertension. So when your body's already fighting these chronic diseases, it's much more difficult to fight a novel virus like the coronavirus. And so that statistic that you said, 3 out of 5 people in Nigeria that have died from the coronavirus as over 50, that's very important, because while that's true, most of the cases, meaning that most of the people who are infected with coronavirus, regardless if they die or not, are actually people aged between 20 and 40. But they're not the ones dying, but they are the largest age population that is transmitting the disease. So that lets you know that the spread of the disease is a responsibility for everybody. Everyone in Nigeria has a father. At one point, everybody has uncles, everybody has mothers, everybody has grandmothers, or if we're blessed enough to have grandmothers that are still living.
When you say it's a responsibility for everyone, don't you think we should focus more on those within that age bracket, 50 upward?
So the thing is what I said. If people in their 20s and in their 30s are infecting people, if you only focus on people 50 and above, then they're still going to be infected, right? I mean, even if you're 50 and you have a child that is in their early 30s and they're infected with coronavirus and they bring you food, then you are actually exposed now to coronavirus. So while over 50s need to take care to make sure that they are really being even more vigilant when it comes to the protective measures. They also need to make sure that they're seeing their doctors for any type of comorbidity or just to have a primary health care check when they can. It's everyone's responsibility to take on these measures, so such as wearing masks, such as social distancing, giving distance between you and the person in front of you at the bus stop or at church or whatever. Because if you get infected, even if you don't die, even if you only have mild symptoms, you can still infect someone else. And if they're over 50, anybody can die from this disease, but yes, more people that are over 50 are the ones that are unfortunately succumbing to the disease. But we just have to know that we all have a responsibility in limiting the transmission of the virus. Does that make sense, Michael?
Yes, you're making sense this morning. But I'd really like to ask you a very important question here, because right here in Nigeria, we are seeing gradual easing of the lockdown. In fact, schools, the graduating classes, those in GSS3, SS3 and primary 6 will be returning to school for their final examinations. Now, markets are to be open, although not all through the week. But does it mean that we should relax on some of those precautionary measures, or we should continue or even add more effort?
We should definitely continue our precautionary measures. Many governments are in the same situation as Nigeria. You have this tension between protecting people's health and making sure the economy continues. The truth is, we can't live in lockdown forever. People will lose their jobs. There are some people that are daily wage workers. They will end up suffering more from the lockdown than from COVID itself. So as these restrictions ease, individuals must take it upon themselves to continue to act in a prudent way, to continue the wearing masks, to continue social distancing. That is how you truly reduce your risk. Now, government also has a responsibility. Abia State government, the state epidemiologist, the health commissioner, the honorable governor, they have a responsibility as well. So making sure that there are hand washing stations in public spaces, which I know they are doing. Some of these markets, if they can be more outside markets than inside, that makes a big difference, because transmission of the disease, so you're more likely to get coronavirus if you're inside and if you're around a lot of people.
Okay,
so
I would like you to take that again
outside,
now. Just a moment. I would like you to take that and buttress that point once again, because we've had situations where church leaders are complaining that markets are being allowed to run their activities while churches and schools remain closed. And they are complaining that it's unfair on the fact that churches we've seen even pastors in Nigeria complaining that it's a virus in quotes. So the risk of infection in an enclosed environment now, probably in schools or in churches, and of course in an open space like a market. Can you take us through the risk of infection?
Yes, definitely. So many viruses, but especially what we've seen in COVID-19, the only way that a virus can survive is if it has a host. So with the studies that we've seen so far, coronavirus can hop from one person to another through droplets. And so that says if you sneeze, if you cough, even if you talk too loud or too passionately, or if you're working out and you're very near somebody else, it's very easy for that virus within, your spit or your saliva to jump onto somebody else. And that's how we get it. It spreads very quickly. So just imagine if you're inside of a church and you're sitting right next to somebody, that you're much less than, 2 meters away or even 1 meter away. Of course, that's going to increase the risk of of getting coronavirus or COVID-19. So that's one. Now, if we think about indoors versus outdoors, right? So studies have shown us that up to a magnitude of 18 times is the risk of COVID-19 indoors versus outdoors. Outdoors, you have wind, you have when you're sneezing, when you're talking, the currents move the virus. It's less likely to be a direct projection from one person to another. And so outdoors is just much safer. I mean, that doesn't mean that you stop social distancing. It doesn't mean that you do not wear a mask.
It is more risky. Safer. It is more risky contracting coronavirus in an enclosed space, like in the church or in the school, than you're in the open space.
Exactly. But of course, schools have to open, and so one thing that schools are doing are looking at how can they have the pupils sit further apart, making sure that the windows are open and so that air can be circulated. So there's different mitigation that schools can do as well as churches. I've seen churches across the continent. Some are having outdoor services. Some are having less people because, Abia churches can congregate. They're just asked to cap the amount of people that congregate at one time. And so, I think we have to get used to this new normal in order to protect ourselves, especially until we have a vaccine or an effective treatment. And that's how we really protect everyone, but especially the vulnerable and the elderly.
Dr. Ngozi, does it mean that the longer you stay in such an enclosed place, the higher the risk of contracting COVID-19?
Yes, that is exactly right, Michael. The longer you stay in an exposed place, the more opportunity the virus has to jump from one person who may have it. Somebody might have it and even not know that they have it. We know that with this virus, there are a lot of people that are asymptomatic. That means that they can carry the virus and have absolutely no symptoms at all. And that's why we're actually seeing, when you do some larger testing or some more community testing, that's why we're seeing younger people that actually have the infection and they don't even know that they had it. So the longer you stay inside and in closed places with a lot of people around you, the more likely you are to get the infection if somebody has it.
Okay, I would like you to take us also on this very confusing issues concerning COVID-19, and in fact the fact that COVID-19 can stay on some surfaces longer than on some surfaces. I hope you would like to take us on that, but that will be after this break. Okay, we've been speaking to Dr. Ngozi Erondu, infectious diseases epidemiologist, a global health policy expert, a senior research fellow at the Chatham House Center for Global Health Security, and a senior public health advisor at Public Health England. Now, it is still Abia State COVID-19 update. The program is live on several radio stations in the state, both in Umuahia, the capital of the state, and also Aba, the commercial capital of the state. We'll take a break now. When we return, we'll take more questions, and of course, we throw the lines open for you to, put your questions together. You can actually drop them on 0906 510 8289 0906 510 8289.
This is Abia COVID-19 update. Abia COVID-19 update.
It is still Abia State COVID-19 update, live on several radio stations in this state: BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. And we've been talking to Dr. Ngozi Erondu, infectious diseases epidemiologist, and of course, she has been speaking concerning coronavirus, some reasons we should keep staying safe, obeying those protocols put together by the government through the Nigeria Center for Disease Control. Now, Doctor, I would like to take you on the virus staying on surfaces. How long can the virus stay on some surfaces, like a table, like your door handles and your papers, so that it will give us reasons, whichever, on how we should, the reason we should disinfect our surfaces?
Mm-hmm.
So,
yeah, that's a very good question.
Yes.
Yeah, sure.
Okay.
So I want to emphasize to people that because COVID-19 is a new disease, because coronavirus is a new virus, science continues to come out. But I will give you what we know so far. I just wanted to put that out there.
Okay.
So we know that even though coronavirus is transmitted through droplets, if you're indoors, especially if somebody sneezes, for example, it can actually be suspended in the air for either a few minutes to a couple of hours. And so that's another reason why indoors is more risky for COVID-19 than
it can
outdoors.
suspend in the air for a few minutes.
Up until even a couple of hours, depending on the the air, the environment. So that's one thing. If you think of air as a surface.
Does that make it an airborne virus?
No, it doesn't make it an airborne virus.
Okay.
So this has something to do with the size of the actual virus. Airborne viruses can be transmitted very easily through air conditioning, through ventilators, and that's not the same thing that's happening with COVID-19. It's more just somebody sneezing and it not necessarily dissipating as fast as it could.
Okay.
So that's one part if we're thinking of air. On cardboard, we've found so far that the coronavirus can stay on cardboard for up to 24 hours. So that's very important.
On cardboard for 24 hours.
On cardboard.
Okay.
Up to 24 hours. So that might, if you're buying things, it might be better to leave them in one place and unpack them and then bring everything inside. That's something that I do
after 24 hours.
Exactly.
Okay.
On stainless steel, so if we think about our pots and pans or even some parts of our kitchens, it can last on those surfaces for up to 2 to 3 days.
Okay. I would like you to take that again. On surfaces in our kitchens.
Mm-hmm.
Okay.
So surfaces on our kitchen, it depends. It can be steel surfaces, it can be plastic surfaces. But what the science is showing, what studies show, that it can last from 2 to 3 days on surfaces.
Okay. What about paper?
So what? On paper, I actually haven't seen specifically on paper. On money, is that what you're asking? Like on money?
Yes, on money.
Yeah, so that's actually a very good point. On money, I have read that it can last for several days as well. Forgive me because I don't know exactly how many days.
Okay.
But this is why one of Nigeria CDC's recommendations is not to use money, not to use paper money as much as possible, is to do the digital transactions as much as possible. But in reality, we still use money. We still, bring things into our homes. And so what really needs to happen is just continuous decontamination. So washing surfaces with antibacterial and bleach. I think many people from my family, Nigerians are very clean. Nigerians are very aware of the need to be clean. And I think that with COVID-19, we just need to be more vigilant, just wiping down surfaces that people touch often. So doorknobs and light switches and places in our kitchen where we're going to bring our hands to our mouth. But it also reiterates why we need to continually wash our hands, especially when we go out and come back in. So
okay.
Coronavirus is a virus. It actually, if you rub your hands together with soap, it breaks down the virus and it kills the virus. So that's why soap and water is so important.
Okay, just before I let you go this morning because of our time, can you get the coronavirus more than once? What do you make of the new reports telling us people are testing positive for it more than once? Shouldn't you be immune after you have it?
It's a very good question, Michael, and I would say that the science is still evolving on that. The latest study that I've seen, and again, it's not the strongest study, but it shows that while we don't know much about immunity, it looks like the coronavirus maybe gives us a couple of months immunity. We do not know yet. There are some viruses that once you get it, you actually cannot get it again. It doesn't seem to be the case with this coronavirus. And it actually doesn't seem to be the case with, if you think about flu or the common cold, you can get that multiple times. So just because you've had COVID-19 before doesn't mean that you can be careless or not careful.
All right, Dr. Ngozi Arondu, thank you very much for speaking to us this morning, all the way from Dubai, United Arab Emirates. It's morning here. Good morning to you once again.
Oh, good morning to you, and thank you so much, Michael. I very much love my state, Abia, and I'm happy to speak more in the future.
All right. Thank you very much, Doctor. Now, Dr. Ngozi Arondu is an infectious diseases epidemiologist, a global health policy expert, a senior research fellow at the Chatham House Center for Global Health Security, and a senior public health advisor at Public Health England, and she's also from Abia State. So that's how far we can go this morning on the program Abia State COVID-19 Update. We want to thank the partner radio stations: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. My name is Michael Oni. Please keep staying safe and take responsibility.
This is Abia COVID-19 Update. Abia COVID-19 Update.